Hi, my name is Juliana. I'm going to be your nurse today. Um, just wanted to come in and give you some information and ask you a few questions. I know you're having a cardiac catheterization tomorrow, so I'm here to answer any questions you may have. But first off, I just want to ask you a few questions if that's okay. First things first, can you tell me your name and date of birth? Hi, Juliana. My name is Sarah Jones. I'll be your patient. Yes, I know I'm having the cardiac cath tomorrow. I do have a few questions for you. I want to know what time I'm on the schedule for tomorrow and what to expect. Birth is 1/18/94. Perfect. Thank you for that information. First things first, I'll just get my assessment done really quick if that's okay with you, and answer a few questions, or ask you a few questions, I should say, and then I'll get all your questions answered. Does that sound okay? Sounds good, Juliana. First things first, I have just some silly questions for you. I have to ask all my patients. Can you tell me where you are right now, what year it is, what town you're in, and what month? Sure, I am in Tampa, Florida at Tampa General Hospital, and I am in November of 2021. Thank you so much. Are you having any pain or discomfort in your chest or anywhere else? No, I'm not right now. I did have a little bit of discomfort last night, but it was relieved. I told the nurse I didn't want to take any nitro last night because it gives me a really bad headache. So I just kind of relaxed and it went away on its own. Okay, well, I know the doctor had talked with you earlier today about your results. I'll kind of just reiterate that for you. You had 3 sets of troponins, which is a cardiac enzyme that gets released if there's any injury to the heart. They were all elevated, which could possibly indicate a possible blockage. And you also had a stress test yesterday, which came back abnormal. I know the doctor had gone over these results with you, so that's what they're making. That's why they decided to do the cardiac catheterization, which will get a better look into your vessels in your heart. Yes, thank you for going over that. I am kind of familiar with the process because I have a family history of it. Both my mom and dad suffered from heart attacks. I guess it's just nerve-wracking to be possibly happening to me. So thank you for giving me that information, though. Understood. Family history is a risk factor for cardiovascular disease, along with hypertension, obesity, smoking, high blood pressure, high cholesterol. I know you're not obese, but do you have any past medical history of hypertension or high cholesterol that you're aware of, or smoking? I do smoke a pack and a half a day. I know I should not, and I was told I need to stop. I really do want to quit, though, because this has really scared me of what's going on. If we're being honest, as far as while you're being hospitalized, I can talk with the doctor and get you a nicotine patch, so that way you're not having any cravings for cigarettes. Appreciate that very much. Now, I'm just going to take a listen to your heart and lungs. If you can just breathe normal. I'm just going to take a listen to your heart and take a listen to your back of your back. If you can take in a deep breath so I can listen to your lung sounds. I am also just going to feel your pulses in your arms, your radial artery, and your pedal pulse in your foot, just to make sure we are getting adequate perfusion. Patient is alert and oriented ×3. No murmurs noted when auscultating for heart sounds. Lungs are clear bilaterally. Next thing, I just want to take a look at your IV to make sure there is no redness, swelling, infiltration, or any signs and symptoms of infection. It looks great. Perfect. Thank you so much for that. Any issues going to the bathroom or urinating and having bowel movements okay? So I actually just peed and had a bowel movement right before you came in here. Any nausea, vomiting, diarrhea? No, I had a little bit of nausea last night when I had the tiny bit of chest discomfort, but it subsided. Okay, well, I'm gonna get you prepped for the cardiac catheterization tomorrow. I know I had briefly gone over it with you. I'm gonna get you to have this sign this consent stating that you had talked with the doctor about this and know the risks and benefits, along with where you are going to shave your groin and your wrist, because that's where they will puncture your artery, depending on the doctor of which site they will go into. Additionally, I'm going to hang some IV fluids. Sometimes the dye they use to get a better look at your vessels and your heart can injure the kidneys. So we kind of just give you some fluids to kind of hydrate and protect from any kidney injury. Okay, sounds good. Do you know what time I'm on the schedule for tomorrow? When I last checked, it was 9 a.m. with Dr. Brown. If there is not anything you need at this time, I will be back and right outside your room. If you need me, just press your call button.